John Ruttle has been living with COPD since 2005. He told us about his experience with COPD and the impact it's had on his life.
I was diagnosed in 2005 with COPD. Prior to that, I hardly went to a doctor. I ended up with a continuous cough. I couldn't breathe, I couldn't walk, and the family finally got me to go. He sent me directly to a specialist, lung specialist. I then found out that I had COPD and gave me 18 months to live. I went back to the GP 2 months later, and sitting around in the reception area, I found a brochure that had COPD on it. And then I realised that's what I had. I just assumed COPD was another flu, and I didn't worry about it. It was a big shock once we found out what it was. And it more or less changed our whole lifestyle. But I had to instantly retire from the Commonwealth Government. And we didn't do much travelling, but we did a little bit of travelling. And then it slowed down because of the problem. And today, I'll be lucky to go out to the letterbox and back without losing my breath. And it really holds you back. Your whole life has changed where you can't do much. And it's, you do see other people running around and you wish you could do the same, but unfortunately, that's the problem with COPD.
John told us about having a COPD action plan.
Well, when you're first diagnosed with COPD, you're supposed to sit down with your specialist or clinician, and they'll go right through everything you're supposed to do day to day, all your medications, exercises, everything else, and that gets put onto the action plan. And then if you feel unwell, it then explains what you've got to do to try to release that. If that doesn't help over a quarter an hour, they recommend you ring your GP. If you can't get onto your GP, they recommend you go to the emergency section at the hospital. But it is a good thing, so my recommendation is get a copy of it and carry it with you no matter where you go.
We asked John about his thoughts on his COPD medicines.
Well, most people on COPD are given inhalers to control or keep their COPD under control. But now they're saying that about 80% of people using these do not use them properly. And they suggest that you either go to your clinicians and get them to check how you do it and correct it, or go to the pharmacy, and they're happy to even help you do it correctly.
John recounted his experience of a COPD exacerbation.
It happens where your breathness becomes worse. You end up with a fever, you get tightness in the chest, you start losing memory, trying to remember things. It's a very nasty thing. But because you're just trying to get your breath, nothing matters. There's another thing called panic attacks, which is what I get a lot. And it just hits you out of the blue. You'd be outside somewhere. And it's very similar to a flare-up, where you just can't get your breath at all. And you just lose everything by trying to get your breath back.
We asked John about his thoughts on pulmonary rehabilitation.
Pulmonary rehab, it's a terrific project. It's an 8-week program. And what they do, they assess you and work out what exercises suit your condition. You do your exercises, and then in the afternoon they have education. And that way it's one of them is living with COPD. You have a dietitian come in, talk about your food and what you should eat now. You have others, mental health, and all these people come through, and it's a very good system. I hope that the COPD clinical care standards will come in and help with these people to go along, because I think if they do this, it would reduce their, it'd increase their life expectancy, but reduce the readmissions to the hospital. The only problem with it, after 8 weeks, you're then told to go home, keep taking your medications, do your exercises, and including myself, when I left, what do you do if you can't go to a gym because they'll kill you? So we then went out and got a couple of grants through our lung support group, and with that money we've got a physio qualified to come in and give us the proper exercises that these people needed.
John told us about his work as president of a lung support group.
The lung support group's been going since February 1999, and for the last 7 years I've been the president. What we do there is that we have bus trips, lunches, professional speakers come in, and most of all, you get to meet other people with the same condition, so you're not alone, and it gets you out of your house and into a group. Yeah, and I think anyone with COPD should join a group, local group near them. But I think the main thing is friendship. Don't just cut yourself off at home, but try to join in with other people who have got the same condition.
John described the support he receives from the clinicians involved in his care.
I'm very lucky. I've got the wife who's very good there. I've got a doctor who rings me every week. I've got a COPD nurse at the hospital, and if I have any trouble, I ring her and she'll come straight back to me. If it's a medical problem, she'll ask what it is, and then she'll decide if it's a doctor, a specialist or hospital job. And I think new people with COPD today need that contact. They need to have a GP, a specialist that they can talk to, possibly a nurse at the hospital that they can contact and become a contact person.
John spoke about the importance of the COPD clinical care standard.
And I think that coming back with the COPD clinical standards, these people get the proper care that they deserve and need. And I think it's a very, very important thing. And hopefully it'll save these people, expand their life, and also it should reduce readmissions to hospitals if these clinical standards are taken into account.
For more information about the COPD clinical care standard, please visit the Commission's website.